do that on which side of the knee, medial or lateral?
Medial.
Medial side of the knee, because which hamstring tendon is lateral? Biceps femoris. Okay. So we're going to put our fingers in the popliteal fossa, and we're going to move medially till we feel what we think is a firm tendon. We're going to have the patient flex the knee, and a tendon should pop up into our hand. That's going to be the semitendinosus. And then from there, we're going to use that to find the membranosus. So from here, go ahead and relax. Let me make sure I'm saying it right. So in this position, it says pes anserine tendons. We're only going to find the semitendinosus and know, because it's too hard to differentiate, that the sartorius and the gracilis are in that same region, and then they all insert at the pes anserine at the anterior medial part of the medial tibial condyle. Okay, so semitendinosus. And then the membranosus, we're going to find the semitendinosus first. It's going to be the most prominent. And from there, we're going to feel a broader, softer structure deep to it. So you're going to essentially be feeling two tendons. Go ahead and flex into my hand. And the kind of flatter, broader one is going to be the semimembranosus, and the more prominent is going to be the tendinosus. Okay? So those two I want you to be able to differentiate between, but don't worry about when they say pes anserine tendon, the book is actually just having you find the semitendinosus. And then just knowing that anterior to that is the gracilis, and even more anterior to that is the sartorius. And then on a lateral aspect, we can find the fibular head. Have Katie flex her knee again, and that's when moving from a little bit more proximal from the fibular head, I can find that biceps femoris tendon. But confirmation of all three is flexion of the knee. Go ahead and relax. And just knowing that the tendinosus is the most prominent, the membranosus is going to feel a little bit flatter, broad, but they're right adjacent to each other. Popliteus. Oh, let's go gastrocnemius first. And we'll get into a little bit more when we get into the ankle lecture. But gastrocnemius is going to come, we're going to come up the calf, and then go ahead and point your toes down. Yeah, there you go, and relax. One more time. Good, and relax. So from there, we're going to work our way up into, and of course I'm coming from the wrong angle, into the popliteal fossa. And from here, what does the popliteus do? Unlocks the knee and medial rotation. So now I'm trying to orient myself. That would be medial rotation. So I'm going to try to externally or laterally rotate her. So Katie, go ahead and turn into my hand. Or don't let me turn you. Let's do it that way. And relax. Now I can't do it from this angle because now I'm not deep enough. Right, go ahead. Let's see. That's medial. That's lateral. I'm going to try to laterally. Don't let me move you. And relax. Good. And again. Good. And then you can feel the popliteus pop up in your hand. If you are too distal, you'll still be on the gastroc. So make sure you're really in the popliteal fossa, and it's pretty deep.
So you were having her medially rotate against you pulling laterally.
Yep. I was trying to pull her into external rotation, saying don't let me, which meant she had to medially rotate. Don't look at my setup and angles, right, because I'm doing this so you guys can see, but make sure you follow the ones in the book. What else do we have? Oh, we'll go one more on your back. Supine. Okay. And so tensor fascia lata. So we're going to go, and so what we're doing here, it's sort of combining palpations in your book. It's saying that you would come from the ASIS, we'd go under skin, and we would move just inferior and a slightly lateral, and have her abduct and or flex the hip to find the TFL. And then, so that's one palpation, and then they're saying we want you to follow the band all the way down until we get to essentially what landmark. They just didn't name it in this book. Until we get to Gerdy's tubercle. So I think just an alternate technique, so based on the book, is if she goes into her side, I think this becomes an easier position to see. Because now that we've put the IT band on a little bit more of a tense position, because it's the muscles that attach to the IT band essentially abduct, so we can adduct her hip a little bit, and it becomes a little bit more taut. And so you can essentially trace the borders of her IT band all the way up. You might find some people in class where it's very distinct. I've had some patients where I'm like, it's just so flat and prominent. Now, the thing is, an IT band, the band itself is not a muscle. So tight, I don't know is the appropriate word. The glute max and the TFL could be tight, but the band itself it's not a muscle, so just keep that in mind. Anyway, so I can trace her IT band all the way down until I get to Gerdy's tubercle. Okay? Okay.